Victor Mohan. I'm going to give you a little background about Victor, and then I'm going to give you some things that we're going to be covering. In this talk before Victor comes on, we're going to be talking about the introduction to concepts for mobile healthcare and patient engagement. You're going to learn a little bit about mobile medical units, a tool to enhance accessibility and engagement, how to personalize care and continuity, and then how to leverage mobile technology for patient engagement, amongst other things. There's a lot of great information. So a little bit about Victor. Victor is a program director and vice chairman of the board at Reach Lives. And a little bit about, he's a board licensed physician with a passion for transforming healthcare delivery and empowering underserved communities. He obtained his medical degree from St. John's National Academy of Health Sciences in 2018 and further pursued advanced degrees from Georgetown University, USA, and the University of Cambridge in the UK. After gaining experience in clinical medicine, he transitioned into the field of public health research and consulting, working across 3 continents in Africa, Asia, and North America. His expertise and contributions have been instrumental in projects and research studies executed by esteemed organizations such as the National Institute of Health in the US, World Bank, WHO, the Ministry of Health of Ghana, and the government of India. Now, I can keep going on and on and on. He has such a wealth of accolades and credentials here. And without further ado, we welcome Dr. Victor Mohan to the show.
Hello, everyone.
Dr.
Hi, Christopher.
Mohan,
thanks for the introduction.
We are looking forward to hearing what you have to share today.
Well, I hope you find some use.
And the stage is all yours.
If I could just get started sharing my screen. All right, everyone can see. All right, hello, everyone. It's wonderful to see people from across the world. My name is Dr. Victor Mohan, and today we'll journey through a critical aspect of modern healthcare that's tackling non-communicable diseases, or NCDs, through mobile patient engagement. Specifically, we'll talk about the role that nonprofits can play in this and the opportunities that can be seized to catalyze their work. But before we get started, let's quickly look at the agenda for today. We'll start with understanding exactly what problem we are attempting to solve. It'll be things that you may already know, but then we'll move on to how the evolving nature of the problem has led to a deep-rooted transition in the way healthcare industry works today. We'll understand the value that's generated in this transition and identify ways that nonprofits can capture that value. And during the process, I'll provide some real-life examples of what organizations are doing today. And that may be helpful for people who are interested in starting nonprofits or looking at new projects to invest in and start. All right, so just to set the scene, let's take a look at a quintessential, rapidly urbanizing city, Bangalore in India. It has a burgeoning IT industry, and consequently, its area has more than doubled since the 1990s. The rapid growth attracts working professionals such as Arya, who is a software engineer and has to juggle between tight project deadlines and virtual meetings. Her solace, like many of ours, is food. Good news for her, Bangalore is home to many startups that will bring her the best in fast food from across the city within minutes. The options are almost endless. The energy from the food is now enough for her to work late. Plus, she finds the need to work late not only because of the work pressure, but also because her daily commute back home could last over an hour, and she's not looking forward to that. Back home, tired from the work and commute, she turns to Netflix. Simultaneously, she orders some more food. She has a gym membership, but the thought of getting back on the road is just nightmarish. She owns a treadmill, but that's more of a clothes hanger than a fitness tool now. Arya isn't alone. Out of the 10 million or so people who live in Bangalore, a considerable portion leads a life that's very similar to hers. Maybe not all 3 domains apply, but every urban resident at least faces one major risk factor. We have seen a 15% rise in diabetes and a 20% rise in hypertension in just the last 5 years in the city of Bangalore. Now, people in cities like Bangalore are surrounded by options which yield immediate rewards, and these rewards overshadow long-term health risks. When everyone around is indulging in a similar lifestyle, it becomes a new normal. This groupthink makes deviations challenging. Now, obviously, Bangalore is not an isolated case. If we step back and look, it's clear that there are scores of cities across the world which mirror Bangalore's growth. The simplistic heat map at the bottom of the screen highlights 40 of the fastest growing major cities across the world. Each one of the heat spots represents hundreds of thousands or maybe even millions of individuals experiencing significant shifts in lifestyle due to rapid urbanization. From Sao Paulo to Nairobi, I notice people are here from Nigeria, so Lagos is included. From Shanghai to Cairo, it's the same story. These cities are only going to continue to grow. Up to 70% of the world's population are going to live in cities by the year 2050. And if you look closely, you'll see that most of the growth is taking place in Africa and Asia. This growth is great, but experts also see the growth of cities reflected in the growth of NCDs. This is called the epidemiological transition. Now, just for clarity, NCDs again are non-communicable diseases. They primarily refer to chronic diseases belonging to 5 categories. That's metabolic disease like diabetes, cancer, cardiovascular disease, respiratory disease, and neurodegenerative disease. These are also sometimes called lifestyle diseases, but here's the kicker. 80% of these NCDs, which kill nearly 7 out of 10 people, are preventable through lifestyle choices. The key word here is choices. Given that such a staggering percentage of NCDs can be averted by our choices, the question then becomes, how do we catalyze individuals to make these healthier decisions? The answer lies in a concept we are all familiar with, but perhaps haven't viewed in this light before. It's patient engagement. Empowerment essentially begins with engagement. If we are to harness the power of choice and prevent the looming threat of NCDs, it's crucial to involve patients in their healthcare journey, making them active participants rather than just passive recipients. Let's walk through this simplistic flow chart. It may be a tad idealistic, but it demonstrates what happens if you engage with patients early. Engaging with patients from the get-go isn't just about medical interventions. It's about initiating a dialogue, understanding their concerns, helping them comprehend the magnitude of their choices. And when patients are engaged this early, in this way, it naturally leads to empowerment. They're no longer in the dark, they're informed. And therefore, with this awareness also comes education. A well-informed individual is equipped to make better decisions. Once a person is educated about their health, there's a transformative shift. They become personally invested in their well-being. It's not just about the doctor's advice anymore, it's a personal mission. This deep-rooted investment is the catalyst for change. Patients begin to adjust their lifestyles, whether it's adopting a balanced diet, integrating regular exercise, or adhering to medication. Compliance isn't really seen as a chore anymore. It's viewed as a commitment to oneself. And all of these steps culminate into this final, most rewarding stage, that's better health outcomes, reduced risks, enhanced quality of life, longevity. So while the choice is individual, the journey is not solitary anymore. Now, it's good to know that medicine as a field is not lying dormant, stuck in the old ways. And by old ways, I mean traditionally medicine has operated with a reactive approach, waiting for illnesses to manifest before taking action. However, with the rising threat of NCDs and the revelations around the power of early engagement and prevention, there is a growing shift towards proactive healthcare. So Medicine 2.0 can be visualized as the era where the locus of medical care was predominantly the hospital. In this phase, patient engagement was relatively passive. The focus was on treating conditions once they became evident, and the mode was primarily hospital-centric. Medicine 3.0, on the other hand, represents the metaphorical extension of the walls of the hospitals to embrace the various facets of our daily lives. So here the locus is no longer the hospital, it's mobile medical units, it's direct chats with health expert, it's health apps, it's wearables, it's community building. It's about catching risks early and integrating health seamlessly into our daily routines. And in this shift of philosophy lies a great bit of value, and this value can be captured by nonprofits. So let's look at the many roles a nonprofit can take in this transition. In general, I see 6 ways in which nonprofits can work. First, we have demand generation and awareness activities. Through community outreach, educational campaigns, and mobilization, they can make individuals aware of the benefits of proactive healthcare and the tools that are available to them. This kind of role, which involves working very closely with the community, also lends itself well to nonprofits acting as bridges, fostering collaborations between technology providers like Glorium, healthcare professionals like myself, community leaders, and policymakers. These partnerships can catalyze innovation, scale solutions, and ensure that resources are utilized optimally. Similarly, by leveraging their on ground insights and experiences, they can advocate for policies that prioritize proactive healthcare, drive investments in the sector, and ensure that the transition to Medicine 3.0 is holistic and inclusive. One of the critical barriers to healthcare access, especially when it involves technology, is affordability. Nonprofits, through grants, donations, and collaborations, can offer financial support. They can subsidize healthcare tools and ensure that economic constraints do not hinder access to proactive medical care. Research and data analysis is another role that nonprofits can fulfill. Uh, it's the primary need of the hour in every digitally transforming business. And in regards to AI in healthcare, there's all this talk about algorithmic bias, especially in terms of diagnostic tools. By collecting, analyzing, and disseminating data on health trends, on intervention outcomes, on community needs, nonprofits can provide valuable insights. This data can guide interventions, highlight gaps, and influence the design of future tools and strategies. One key component of Medicine 3.0, as I briefly touched upon in the past slide, is digital health. And I thought this quote from the FDA commissioner was particularly relevant. I think NGOs can take it upon themselves to make the adoption of tech and overall transition more inclusive. Finally, we come to perhaps the most obvious and well known role. Nonprofits can act as direct providers of healthcare services, especially in underserved regions, the so called medical deserts. And in this regard, one of the most innovative and impactful ways in which NGOs have been delivering healthcare is through mobile medical units, or MMUs. So MMUs are essentially healthcare on wheels, clinics on wheels. They are specialized vehicles equipped with a varying range of medical services that they bring to the community instead of waiting for people to come to the hospital, which one does only when one is already fallen ill. So proactive versus reactive. Now, initially, they were devised as a way to bring care to rural areas, but their relevance in urban settings is now well known. School health checkups, health checkup days at places of work, outdoor clinics in informal settlements, the so called slums, and even in case of disaster relief. MMUs are very relevant because they are modular and adaptable, providing services that range from simple screening of blood sugar to dispensing medications, and from something as advanced as radiography to something as simple as immunization. Now, here's a tangible example of MMUs in action. It's a case study of an MMU project run by my organization, Reach Lives, which is a nonprofit that works in health, nutrition, and education for children in India. One of our projects is the MMU project, which was introduced only recently in 2021. So these MMUs are funded mostly by grants and CSR funds. They also follow a tiered pricing structure for the beneficiaries, which depends on the socio-economic status of the area and the intervention in question. The MMUs are staffed by a doctor or a nurse, an assistant healthcare worker, and a driver. And as I mentioned before, MMUs are modular and they are adaptable. So depending on the demands and the schedule of the day, other professionals may join or not. And because of this adaptability, the MMUs are each capable of handling around 50 patients a day, with a mix of services which range from screening for high blood glucose and high blood pressure and conducting pap smears in workplaces, to immunization in schools, and from education in informal settlements to distribution of ration kits and PPE kits during COVID-19. The MMUs are telehealth enabled and are connected to a patient data repository, because of which electronic health records, or EHRs, can be created, accessed, and modified wherever the MMU goes. So you can see the NGOs filling quite a few roles actually with the MMUs. On the face of it, there's obviously healthcare delivery, but also there's demand and awareness generation, because There's educational activities that take place simultaneously. Plus, patients are made aware of issues that may require higher order care and are provided with a list of tertiary level access points, which provide subsidized care and government schemes to help them. This encourages the patient to seek healthcare early. Now, during this process, the MMU clearly is also functioning as a data collection and processing entity, and within reason and as long as regulations allow, these data can also help research and guide future innovation. So a lot of what you see on this page and in this side panel paints a very rosy picture, and there have been a lot of successes. For instance, various key performance indicators, KPIs that we employ show very positive trends. The engagement rate with patients is growing, the follow-up or retention or compliance rates have jumped significantly, and the net promoter score, which is how likely a user is to recommend your services to another person, is quite high. And overall, we're beginning to see population sector level improvements in health outcomes, although it's far too early to definitely conclude anything about outcomes. But there are challenges. There are many challenges. The primary challenges are financial sustainability, like every other nonprofit, and resource constraints. NGOs everywhere struggle with unreliable funding sources in the form of grants. One year you have a grant, and the next year you don't. There has to be a robust financing system in place that includes the end user of your services and cost recovery. So you're not just looking at third parties to fund your projects, you're also looking at recuperating some of your costs from the end user or the beneficiary themselves. So usually what nonprofits do is they subsidize a fee for service. That's the go-to cost recovery method. But there are organizations, usually government bodies and organizations with a union or an organized community of people who are attempting to experiment with alternate cost recovery methods, which include a social financing component. And that could prove effective. Our technology can yield good dividends in terms of savings in human resource costs. Currently, Reach Lives is doubling down on its telehealth capabilities to bring down costs and augment capacities. Specialty care, for instance, is almost exclusively delivered through telehealth. Now, progress is being made in technologies like AI-powered speech-to-text and AI diagnostics that could significantly cut the amount of time physicians have to spend with each patient on non-essential things. Another key technique being explored is the collaboration with the community and the creation of community health volunteers who help in understanding health trends, who act as early sentinel surveillance, establish a feedback loop, and all of this leads to significant cost savings in operating costs, at least in the long term. Essentially, you're trying to reduce the time that the MMU spends in a community beyond the essential direct patient contact time. Volunteers also actually help with another set of challenges, especially in poorer communities, by tackling local cultural and behavioral patterns and lack of awareness of the MMU services. Now, MMU projects are run across the world. I've added a list of organizations that use MMUs in different capacities. These range from Essilor, the lens maker, which runs refractory units, vans that go and test your eye power in different communities, to Stanford's child health clinics on wheels. You can check them out if you're interested. Now, on this slide, I'm talking about the future opportunities for new nonprofits looking to enter the field of healthcare, or specifically looking at how do you engage patients in medicine 3.0, that is beyond the hospital. How do you engage patients? And this is just a non-exhaustive smorgasbord of ideas that are in various stages of development or implementation. But essentially, what you're looking at is a lot of innovation that sits at the intersection of technology and human-centric solutions. So as a nonprofit, on the one hand, you're making humans want to and have the capacity to use tech to the fullest. And on the other, you're making the development of technology more in line with the true priorities of society that go beyond just profit. In general, an NGO's roles can be any of the following. One, NGOs can subsidize devices which people need to use to access the tech. This includes things like wearables and health monitors. The second thing that NGOs can do is raise digital literacy. This is the need of the hour. There's no point in having wearables, technology like AI, if we do not have people who are previously underserved being able to use these technologies. So this includes the elderly, the poor, the people with disabilities. Nonprofits can take an active role in making them more digitally literate. The third thing that nonprofits can do is create content that gamifies health or makes health education accessible, especially to people in the fringes. Now, I'll give you a real life example of health being gamified in the next slide. But for what nonprofits can do is develop the tech themselves. Now, OpenAI, the creators of ChatGPT, they started off as a nonprofit. They've since transitioned to a for-profit entity, but it may be financially unreasonable to expect nonprofits to develop tech on their own. But an alternative, more feasible way would be to work very closely with tech companies themselves in a research and data collection or cleaning role, and by guiding for-profit companies in creating inclusive solutions. Now, I talked briefly about algorithmic bias. I don't want to overstep my boundaries. We have a lot of speakers going to be speaking on AI, but that is something which runs the risk of leaving behind a giant chunk of the population based on parameters such as race and gender. And I think nonprofits can really work at that level, cleaning the data, collecting the data to help these tech companies develop better inclusive algorithms. Now, in terms of developing tech, NGOs could also develop platforms integrated with health records, offering individuals control over their health narrative. Now, this isn't something we can take for granted because vast regions of the world, especially in the high growth areas of Asia and Africa, people still lack access to EHRs, electronic health records. So that can be something that nonprofits can do also. Finally, nonprofits can eschew the technological revolution and adopt a more human-centric approach. The traditional ways that NGOs have always used are still very relevant. NGOs can work directly with the communities, like I mentioned before, to create volunteers or ambassadors or even health workers to promote proactive healthcare delivery. The aim is to get people interested in their health, get engaged with reading metrics about their health, seeking healthcare for addressing risk factors and not symptoms of disease. So technology is clearly the easiest way because everyone today owns a phone. But if you're talking about a slum or an informal settlement, having a community health volunteer or an ambassador who's leading by example can also prompt the rest of the people to be very proactive about their healthcare, about their health. Now, this is a real world example of health gamification done right. Now, gamification is not really new. It taps into our love for fun, challenge, and reaching milestones to achieve something that would otherwise be mundane or feel like a chore. Peloton, for instance, the exercise company, the tech company that's into exercise, has made massive strides in making exercise fun through gamification. But that's a massive unicorn, and it's a completely for-profit entity. Impact Steps, on the other hand, is a simpler, smaller scale implementation of health gamification. You choose a cause listed by one of the various CSR partners of Impact and begin going about your day. Every kilometer you cover, the CSR partner donates 10 rupees or 1/8, so 12 cents to the cause. It's simple, but by gamifying the mundane task of walking, you are encouraging both personal and societal well-being. But the true potential doesn't stop here. If you remember the flowchart I showed previously about patient engagement, through this app, we have reached the level of personal investment. At this stage, the person using the app is more involved in their personal health status. They become more proactive about optimizing their health, which is exactly the point of Medicine 3.0. Now, there are plenty of other organizations like MSF, which are using telehealth to reach unreached population. Arman is an incredible organization. It's a massive organization. They use IVR calls to make expectant mothers more proactive about their antenatal health while they are pregnant. I've also listed a few other organizations. You can feel free to check them out and check the way work that they're doing in terms of patient engagement. Finally, before I leave, I thought I would give you a very simple, perhaps generic, but still important roadmap that may be beneficial to anyone starting up in the nonprofit world. It may even help you avoid some common pitfalls along the way. I would advise anyone who's interested in the nonprofit world to start with understanding what the core issue is. As someone who's worked in various geographies across the world, I can attest to the fact that there is no one size fits all solution. Top down implementation of projects across different settings will always inevitably fail. A thorough needs assessment with due consideration to the local context is vital to understanding and articulating what problem you're solving. If you want to establish a nonprofit and work in, let's say, Accra in Ghana, you need to understand what the people of Accra need, not what is working in another context, maybe in Sao Paulo or somewhere else in the world. The next thing to do is to collaborate and co-create. Too often we think of the end users of our projects, the beneficiaries, as passive recipients of your help. They don't have to be. They have valuable insights that must be tapped into during the ideation and the development phase and the pilot phase. Talking about piloting, you need to pilot and iterate some more before rolling out. As you roll out your projects, remember it's important to help the community understand what you're doing and why. Simply providing healthcare services is very different from spending the additional time to educate the people on why you're providing the services and how they should approach healthcare. Working closely with a community like this will also help you constantly monitor your progress. And in this regard, choosing the right indicators to fit into your theory of change is invaluable. So use right indicators to refine your approach. And finally, do not work in isolation. Other nonprofits exist, the government exists, and the private sector exists. You will be most effective if you know how to generate synergies with all stakeholders. That's it for my talk. I hope I was able to add some value. You can learn a lot more about my organization that I talked about earlier at reachlives.com. And I'm happy to connect with anyone on LinkedIn if you find my talk interesting or want to speak to me more about anything else.
Well, Dr. Mohan, thank you so much for sharing such great insights to this particular area. I got a lot of great information personally. We had a few questions from our Twitter viewers that, if you don't mind, if I'm going to ask you if you could address, also will be beneficial for those that are listening here live. How is patient data privacy ensured with mobile healthcare technology?
This question is incredibly important because the beneficiaries, the people who are actually giving you the information for you to collect data, are very vulnerable. They don't know their rights. And honestly, it's very easy to take advantage of them. And that's why I said local regulations matter, right? There's no one set of rules that anybody can follow anywhere in the world. Local regulations matter, and it's also very important to educate yourself in those local regulations, and even better, try to find a technology partner. Maybe you do not have the know-how of how to secure patient data, which is just such vulnerable data. Maybe partner with somebody like Glorium, for instance, who have worked with other organizations and therefore have a set protocol in place to prevent leakages or to prevent data from being mismanaged, things like that. I think many nonprofits start collecting data and they don't know how valuable the data is. So
Yeah.
I would suggest partner with someone who knows what they're doing.
Great. Thank you for sharing. I think we have time for just one more quick question. Even though what successful partnership example for mobile healthcare in underserved areas? What would be a successful partnership example?
Yeah. I'd listed a bunch of organizations actually of successful mobile. For instance, I can draw from my own example. We are working with Rotary International. So that is a body that works with their country representatives in different parts of the world. So that's funding that comes in. We are the implementation organization. So you can search up Rotary International. They have projects across the world. Or there was also another website that I'd suggested to people. It's called Mobile Health Map. Have a look at Mobile Health Map. It lists over 1,000 different mobile health operators, and it will provide far more information than I can ever do.
Well, thank you so much for sharing that. And I know there'll probably be some other questions that we'll make sure that we can try to address a little later. We want to thank you for being here and serving with us today.
Thank you very much.